First, coming to carbohydrate digestion. In mouth, ptyalin, that is salivary amylase, acts on cooked food. The products of digestion are maltose, maltose, and alpha-dextrins. In stomach, no amylytic enzyme is secreted by stomach. Salivary amylase action continues in the stomach till highly acidic gastric juice mixes with food and makes it inactive. The products of digestion are maltose, maltose, and alpha-dextrins. In upper small intestine, that is in duodenum, the pancreatic amylase acts both on cooked and uncooked food at 1,4 glycosidic linkage. The products of digestion are maltose, maltose, and alpha-dextrins. The lower part of the small intestine, final digestion of carbohydrates takes place here. Enzymes used are brush powder enzymes, and it includes disaccharidases. Like you can see, alpha limiting dextrinase converts dextrin into glucose. Maltose gets converted into glucose in presence of maltase, and sucrose, lactose are converted into glucose, fructose, glucose galactose in presence of sucrase and lactase respectively. Absorption of carbohydrates. They are absorbed in the form of monosaccharides. Glucose and galactose, commonly they are absorbed by sodium dependent active transport mechanism system. Fructose is by facilitated diffusion, and pentose is by simple diffusion. Glucose and galactose are absorbed by sodium co-transport mechanism. The carrier protein is called SGLT1, that is sodium dependent glucose transporter. Glucose and sodium combines with SGLT1 and is released inside the intestinal cell. The sodium is transported into the lateral intercellular spaces, and the glucose is transported by glucose transporter 2, that is GLUT2, into the interstitial space and thence the blood and thence to the blood capillaries. Okay. So here you can see the absorption of the glucose. It's always with the sodium with the SGLT1, and when it is glucose is reabsorbed, then it is transported to the blood by the by facilitated diffusion through the GLUT transport